Zolpidem Tablet, Sublingual is a medication used for a short time to treat a certain sleep problem known as insomnia. It helps people who have trouble falling asleep by making them fall asleep faster, so they can get a better night's rest. Zolpidem belongs to a class of drugs called sedative-hypnotics, and it acts on the brain to produce a calming effect. The recommended daily dosage and optimal timing for taking Zolpidem Tablet, Sublingual should be determined by a healthcare professional. Before taking Zolpidem, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth on an empty stomach, usually just before bed. Place the tablet under your tongue and let it dissolve. Do not swallow or take it with water. Do not take a dose of this drug unless you have time for a full night's sleep of at least 7 to 8 hours. The dosage is based on your gender, age, medical condition, and other medications you may be taking. Do not increase your dose, take it more often, or use it for longer than prescribed. Women and older adults are usually prescribed a lower dose. If you suddenly stop using this medication, you may have withdrawal symptoms. When using this medication for a long time, it may not work as well. This medication may sometimes cause addiction, so take it exactly as prescribed to lower the risk. Tell your doctor if your condition lasts after 7 to 10 days, or if it gets worse. You may have trouble sleeping the first few nights after you stop taking this medication. This is called rebound insomnia and is normal. If this effect continues, contact your doctor. You may experience dizziness or difficulty with coordination when taking Zolpidem Tablet, Sublingual. If these effects persist or worsen, inform your doctor or pharmacist. To reduce the risk of dizziness or falling, make sure to get up slowly when rising from a sitting or lying position. This medication may cause daytime drowsiness, so it's important to tell your doctor if you experience this. Your doctor may need to adjust your dose. It's important to remember that this medication has been prescribed to you because the benefit outweighs the risk of side effects. While many people using this medication do not experience serious side effects, it's crucial to tell your doctor right away if you experience memory loss or any mental/mood/behavior changes. Although rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. There have been rare instances where people have engaged in activities such as driving, sleepwalking, preparing and eating food, making phone calls, or having sex while not fully awake after taking Zolpidem Tablet, Sublingual. These individuals often do not remember these events. If you experience any of these activities after taking this medication, it is crucial to inform your doctor immediately. It is important to note that if you have had this reaction to this medication or similar medications, such as isoprene or Zolpidem, you should not take this medication. Before taking Zolpidem, make sure to tell your doctor or pharmacist if you have any allergies or if you are allergic to this medication. It's important to also inform them about your medical history, especially if you have kidney or liver disease, breathing problems, mental health issues, a history of substance use disorder, or a certain muscle disease. The effects of this medication can last even after you wake up the next day, so it's important to get 7 to 8 hours of sleep after taking it. If you have not had enough sleep or have taken other medications that make you sleepy, you may feel alert but not think clearly enough to drive. You may also experience dizziness or blurred/double vision. It's important to avoid alcohol and marijuana while taking this medication and to wait at least 8 hours before driving or operating machinery. Before having surgery, it's important to inform your doctor or dentist about all the medications you are currently using. It's important to note that children and older adults may be more sensitive to the side effects of this medication, and pregnant or breastfeeding women should use it only when clearly needed and under the guidance of a doctor. If you notice any unusual symptoms in your newborn or baby, it's important to seek medical help right away. It's important to be aware of the potential drug interactions that can occur with Zolpidem sublingual tablets. For example, sodium oxybate is one product that may interact with this drug. Additionally, other medications can affect the removal of Zolpidem from your body, which may impact how the drug works. Examples of these medications include azole antifungals, rifampin, and St. John's wort, among others. There is a risk of serious side effects, such as slow or shallow breathing and severe drowsiness or dizziness, if this medication is taken with other products that may also cause drowsiness or breathing problems. It's important to inform your doctor or pharmacist if you are taking other products such as opioid pain or cough relievers, alcohol, marijuana, other drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also crucial to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns or questions about using these products safely, be sure to consult with your pharmacist. If someone has taken too much Zolpidem Tablet, Sublingual, and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include slowed breathing or being in a deep sleep from which you cannot be awakened. It's important to always take this medication exactly as prescribed to avoid any potential risks. If you have any concerns or questions about taking Zolpidem Tablet, Sublingual, be sure to consult with your healthcare provider. It's important not to share your Zolpidem Tablet, Sublingual, with others, as it is against the law. As we age, our sleep patterns may change, and we may experience interruptions in our sleep. Before turning to medication, it's a good idea to consult with your doctor or pharmacist for alternative ways to improve your sleep, such as avoiding caffeine and alcohol close to bedtime, avoiding daytime naps, and establishing a consistent bedtime routine. This can help address any sleep issues you may be experiencing before considering medication. And remember, always follow your doctor's recommended dosage and timing for taking Zolpidem Tablet, Sublingual. If you forget to take a dose, do not take it unless you are able to sleep for 7 to 8 hours after. Refer to the How to Use section for more information. It's important to store Zolpidem Tablet, Sublingual, at room temperature away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.